Welcome, everybody. Thank you so much for joining us today for our webinar on prevention strategies for managing children with challenging behavior. Your presenters today are Annie Maldonado and Ashley Coombs. Annie Maldonado is a school psychology doctoral student at the University of Utah. Annie served as a special education teacher in South Florida, where she worked with students with autism spectrum disorders and their families, and her research and clinical interests revolve around this population. Ashley Coombs is a second-year school psychology graduate student at the University of Utah as well. Ashley is also currently pursuing her BCBA. Just a couple of things before I turn it over to Ashley, that we will be having a Q&A session 15 minutes at the end. So if you have a question that you would like answered, please feel free to drop that in the chat box. And to please remember to mute your sound. And if you are comfortable, please feel free to turn on your video. And yeah, that's it. I'm going to turn it over to Ashley.
Perfect. Thank you so much, Annie. So Annie and I today will be presenting. Annie unfortunately couldn't be here with us in person, but she has pre-recorded her portion of the presentation. So we will put that on up here for you in just a moment. And then afterwards, like Annie mentioned, I will be doing a Q&A. So feel free to drop questions in the chat as we go through, and then we'll just address them all in those last 15 minutes. Thank you all for being here.
Hi, everyone. Welcome to November's webinar on managing child challenging behavior by using prevention strategies. My name is Annie Maldonado, and I am a graduate student at the University of Utah's Educational Psychology Department. You likely already met Ashley Coombs, who is also a student within the same department. And we are excited to present to you guys some strategies on how to prevent challenging behavior in kiddos. And we're going to be providing this information within the context of both the classroom as well as the home. So this will be excellent for both teachers and parents. And although this specific portion of the webinar is pre-recorded, Ashley will be conducting a Q&A session at the end of the webinar. So if there are any questions or concerns that you have about the content throughout the presentation, please feel free to bring it up at the very end. So today we're going to be discussing the ABCs of behavior, as well as talking about some specific antecedent interventions, and also those prevention strategies within the context of the categories that exist for them, and then specific examples for each of these categories, as well as take a little bit of time at the end to talk about how to implement and create visual schedules, which are a great type of prevention strategy. So when we talk about behavior, I think it's important that we recognize that behavior is somewhat attached to a couple of other things that also impact behavior itself. And these are the antecedents and the consequences. So when we talk about the ABCs, we mean antecedent, behavior, and consequence. And antecedent refers to anything that happens prior to the behavior that essentially evokes or triggers the behavior. Then we have the behavior itself, which is what the child does or says, and then the consequences, which is what happens immediately after the behavior, and typically tends to determine whether the behavior will happen again. So in this presentation in particular, we're going to be focusing on antecedent interventions. And again, the antecedent refers to the settings. So in essence, whether this is happening in the classroom, whether it's happening in the dining room table, whether it's happening at grandma's house. It also refers to specific people. People can also somewhat trigger or evoke behavior. And so you can essentially think about specific classmates within the classroom. You can think about behavior or antecedent as either mom or dad or grandma. And then finally, events. There are specific events that also trigger or revoke behavior. And these events can be considered sometimes demands. So being presented with math assignment in the classroom or being asked to take a bath at home. So these are all examples of antecedents. And again, they refer to people, settings, and events. So before we jump sort of into the specific strategies that can be implemented, it's also important that we understand that behavior, because it can be better understood when we look at the antecedent and the consequence, that we also collect data on the behavior and when it happens and what could be particularly causing this behavior to happen, or the function of the behavior will be greatly determined by conducting some data or collecting some data. And so if you take a look at the chart that I have on the screen, you'll notice that we collect data on the date that it happens as well as the time. Oftentimes we can get tons of information out of even just that alone. In case that there are patterns in behavior, that's something that we would be able to tell. Is the behavior happening during specific moments in the day, or multiple times a week, what days of the week. And then we also track what activity is taking place during the time when the behavior happens, as well as the antecedent. So again, that settings, people, and event, and then the behavior itself. And at this point, it's very important to emphasize that whenever we are describing a behavior, it's important that we provide great detail and that we are very specific about what exactly the behavior looks like, because then that in essence will allow other people to be able to pinpoint the exact behavior if they have a good description of what the behavior looks like. And then finally, the consequence. What happened sort of immediately after the behavior took place. And again, all of this information can really provide additional insight into the behavior. And one particular way that it can do that is by allowing us to figure out what the function of the behavior is. I feel like this might require like an entirely different webinar to explain, but essentially the functions for behavior, there are 4 of them. A function is getting attention. So a child may engage in a behavior to get attention. A child could also engage in a behavior to get access to an activity or get access to a tangible or a preferred toy or a preferred item. A child may also engage in behavior to escape or avoid having to do something like a task or a demand. And then the last function has more to do with sensory stimulation, and we typically call it automatic reinforcement. And so that has more to do with that sensory input that the child is receiving. And so again, like I mentioned, it takes an entirely different webinar to describe all of them, but just so that we have sort of a quick introduction, those are the 4 functions of behavior. Now, because we are focusing on antecedent interventions, and antecedent interventions really refers to prevention strategies, which is also known as antecedent management strategies. And again, what we're hoping to do is to provide some supports or strategies that can be implemented before the behavior even takes place. And so we want to prevent the behavior from happening to begin with. A critical element in designing an effective academic or behavioral intervention is carefully selecting sort of those antecedent strategies that are going to make responding more likely to happen if we want to increase the behavior, or less likely to happen if we want to decrease a behavior. And so although consequences can really be applied to strengthen or diminish sort of the strength of a behavior, again, we're looking at specific antecedent strategies because we don't want the behavior to even take place. And so that's what antecedent interventions are all about. And so you can think of antecedent strategies as sort of setting the stage. And in a similar manner that you might have a director kind of set the stage for a successful sort of dramatic performance. And directors typically do this by sort of arranging the props and sort of cueing the actors as to where they should stand and setting up the lighting and the sound effects and the scenery. And so all of these things essentially set the stage and sort of guide actors into what kinds of things they should be engaging in, what kind of behavior they should be engaging in. And so you can think of antecedent strategies as working in a very similar way. As a parent or as a teacher, you're setting the stage for particular behaviors to happen or to avoid having these particular behaviors happening. And so you're setting up specific things in the environment, in the stage, so that the child, just like an actor would behave in a particular way. And so a couple of examples that come to mind. One specific behavior, let's say the child is being directed at home specifically to do homework or even to take a bath, and the child becomes non-compliant. The behavior here is non-compliance. A specific type of prevention strategy that can be implemented is changing the way that you ask a child to do a task. And so providing choices can often really help. And so asking the child, do you want to do your homework or do you want to take a bath first? Essentially, it gives the child the autonomy to sort of decide what they want to engage in, even though they really would prefer not engaging in either. But being given the option of either of the two makes them feel more in control of what might happen. Another example is when a behavior in terms of when their child is being requested to complete a math worksheet in the classroom. Let's say the math worksheet has 25 problems and it looks very long for the child. The child essentially engages in some disruptive behavior because they want to not engage in the task. And so avoiding would potentially be the function there. Essentially, the teacher can potentially break the 25 problems into 5 separate worksheets and have 5 problems per worksheet. And the prevention strategy there would be sort of breaking up tasks into smaller steps to help prevent some of this challenging behavior from taking place. Another example would be, let's say a child engages in crawling around the house. And I feel like this is something that most parents will definitely understand, having a baby or an infant crawling around the house and sort of encountering many potentially dangerous events, items, or situations. And so a prevention strategy for that particular example might be attaching gates to the stairways, plugging all the electrical outlets, and putting locks on cabinet doors. Essentially, the idea here is that you want to prevent the baby or the infant from engaging in some of this potentially dangerous behavior. So you're putting some things into place. You're controlling the environment, essentially. So those are some examples of what we mean when we talk about preventing specific behaviors. And so there are a couple of categories. So prevention strategies can be categorized into controlling the environment, doing things in small doses or steps, changing the order of events, responding to early signs of the problem, changing how you ask or respond, addressing the setting events, and using visual or auditory cues. So what we will be doing now is going into the details of each of these prevention strategies and providing some examples for each of these. So when we talk about controlling the environment, there are a number of ways that both teachers in the classroom and parents at home can control the environment. Some teachers control the environment by seating children away from others who can tend to sort of set them off, or by using certain partitions that might limit certain distractions. And so that's one way that teachers control the environment. They might also control the environment by limiting access to materials. And so if a child is going to have access to the paint and essentially disrupt the class or make a mess with the paint, the teacher would then potentially put it away until the paint is needed or she is ready to sort of guide the kiddos in using the paint. And so limiting access to materials is another way to control the environment. At home, the same can be done by potentially having the parents place items away, or the placement of specific items. For instance, if the parent is wanting to encourage a child to use, to sort of have a choice in let's say cereal boxes during breakfast, then the parent may want multiple options out. But if the parent is trying to limit the amount of sugar consumption and doesn't want the child to eat some sugary cereal potentially, then they might put away those boxes altogether, so that when the child comes to the table, they just see the options that are available for them to eat. And so the placement of those items, putting certain things away, is also going to be beneficial. And then one example that comes to mind that I think it's an excellent way to target more behavior when it comes to going to bed or bedtime behavior is the idea of controlling the environment to create a sleepy bedroom. And so the way that might look is potentially lowering the thermostat and the temperature to maybe 65 degrees Fahrenheit, creating the room so that it feels sleepy by, in addition to lowering the thermostat, maybe having some white noise machine right outside the door so the child doesn't get disrupted in their sleep with noises that may be happening around them. Potentially having darkened curtains so that the sunlight doesn't shine through and wake up the child. Other things could involve also putting nice soothing music to put the child to sleep. So those are ways to make sort of a sleepy bedroom and controlling the environment to create an atmosphere that sort of allows, or like we said before, evokes or sets the stage for the child to fall asleep. And so that's the idea of using different strategies, but particularly controlling the environment as a way to set up the stage for certain behaviors to happen, or to reduce certain behaviors from happening. And then the other type of category is doing things in small doses or in small steps. So in terms of this, there are a couple of different ways to do that. Specifically, sort of shortening the amount of time for events or activities. If a child becomes disruptive when they are for long periods of time in one particular location or setting or event, then sort of going to these places for a short amount of times. And some ideas that come to mind include sort of birthday parties or family gatherings, maybe trips to the grocery store. And essentially, these are strategies that are not in place sort of forever, right? These might be strategies that might be essentially implemented initially, but then faded away or increased as far as like how long a child is able to be in one location or in one event, increasing that amount of time and training the child in that way. But initially, some of these strategies could really help in preventing behavior that almost feels out of control. And then one other thing is sort of providing breaks between tasks. And so not just sort of doing things in small doses, but providing those breaks could essentially also help kiddos who potentially cannot do a demand or a task in one sitting for long periods of time and might engage in some disruptive behavior if they do. So this is the other sort of strategy that can be implemented, is doing things in small doses or steps. The other strategy that we have is changing the order of events. And you might think of this almost like the grandma's rule, you know, first eat your veggies and then you can have access to your dessert. And so essentially allowing kiddos to first engage in their least preferred activities and then follow those activities with the more preferred ones. And so in that way, you're sort of using the natural environment as a reinforcer for them. And this can be especially helpful for a kiddo who, say, has a difficult time stopping an enjoyable activity when they're asked to comply with a demand. So instead of allowing the kiddo to sort of watch videos on their device, first asking them to do their homework and then getting access to the device might be a way to minimize some of those behaviors that may come about because now they're asked to stop doing an activity and engage in a demand that they might not like as much. So there's another way to sort of set the stage for appropriate behavior when it comes to transition, as well as just complying with specific demands. The other type of category of prevention strategies is responding to early signs of the problem behavior. And a couple of things to think about is you might want to begin sort of noticing the early signs of a child's becoming irritated or frustrated. And so that might be a certain look or a certain movement or, furrowing of the eyebrows or pouting. And these are signs that the child could begin soon to engage in some more challenging or more disruptive behavior. And so the idea is to provide the child with the help they need before the behavior worsens. And so an example that I have in mind is a child who has maybe a hard time dressing themselves, putting on buttons, zipping up zippers. These might be things that might become frustrating for some kiddos that may not have the dexterity to be able to do some of those things on their own. And so they may begin making noises like, oh, I can't do this. And then for some children, that's where it ends and they will ask for help. For other children, the behavior might, sort of get amped up. And so that's where you as a parent or as a teacher would come in and provide some support before the behavior gets worse. And so responding to some of these early signs of the problem is essentially going to be really helpful in minimizing some of those sort of more challenging problematic behaviors. The other category of prevention strategies is changing how you ask or how you respond. Some children sort of overreact with the demands are set in a certain way, especially when there's some transitioning involved, or if a child is told something that he or she does not want to hear. Somewhat like an example would be not being able to have access to something. And so sometimes just hearing the word no, or you can't, or something of that nature will sort of trigger certain children, and you might get more sort of explosive responses or behaviors. And so in order to minimize the chance that that will happen, and in order to prevent some of those more challenging behaviors, changing how you ask or respond to a child is really going to help set the stage for more appropriate behavior. So a couple of examples of that include providing choices, and we talked about an example of this earlier. There are a couple of different ways that you can provide choice. You can provide the choice of a task or a demand. As I mentioned earlier, do you want to do your homework first, or do you want to take a bath first? Essentially, you're not removing the demand itself. They still have to complete it, but you're still providing them the opportunity to decide, which again provides them with some autonomy and control over choice, having the opportunity to decide what they want to do first. Another way to provide choice is by providing a choice for reinforcers. Again, reinforcement is sort of typically done to follow as a consequence, right? To follow a behavior that you want to increase, that you want to provide some positive reward for. And so by providing kiddos with the choice of reward, it also provides them some control and some autonomy over what they can and cannot control. And so that's another good way to sort of set the stage for appropriate behavior to happen. There are also high probability commands. And high probability commands, there are a couple of different things that you can think of this. When we talk about high probability commands, we're talking about those tasks that when asked a child to complete, they can very easily comply with. And so essentially, if a child really likes candy and you tell them, here, eat this candy, that will likely be a very high probability command. They will likely engage, totally happily in that specific command. Whereas a low probability command might be something like, here, write a 25-page document, or here, go take a bath or brush your teeth. And for some children, that might be sort of a lower probability command, and that they will be less likely to engage in that behavior. So by providing first a couple of high probability commands, and then providing a low probability command, some momentum is built in that behavior sequence, and kiddos then are more likely to engage in the low probability command if it has been first, if higher probability commands have preceded it. And so this is a great way to be able to change how you ask or how you respond to kiddos. So essentially, you want to be able to provide a sense of success in that they engage in these high probability commands, something like stand up, walk over there, walk back, high five, touch your nose, touch your head. These are all things that most children will be happily engaging in, and then hit them with something that they might not be as likely to do. So one way to implement this in the classroom might be to sort of play Simon Says. And this might be something like, okay, guys, we're going to go ahead, and before we start our next activity for the day, let's play a game of Simon Says. And okay, Simon says, touch your head. Simon says, hop on one leg, and so on and so forth. And then suddenly Simon says, sit down, open the book to page 20 and begin working on problem 5. And so essentially all of these behaviors have built up because they were sort of higher probability commands. And then by the time they get to this one command that they're less likely to engage in, there's been enough behavioral momentum built that they will be more likely to engage in that behavior and be more successful with it. The last type of way that you can change how you ask or respond is by adding a little bit of mystery. And so sometimes, especially in the classroom, kids can be informed that a certain behavior is going to be required, and that there's kind of certain criteria that they need to meet to then be able to have access to this sort of mystery reward. And so providing the children with sort of something to look forward to. And again, this could very easily become a consequence, because essentially you're rewarding behavior after the behavior has already occurred. But it's also an antecedent strategy in that you're sort of creating a little bit of mystery. You might be able to get something, or you will get something if you follow these rules, or if you engage in this particular behavior that I want you to engage in. And so adding that little bit of mystery can essentially create some motivation for the kiddos to engage in that particular behavior, and in that way set the stage for them to successfully comply with the demand that has been set up for them. The other type of category as far as prevention strategies go is addressing the setting events. And so this can in essence refer to things in the environment that can sort of momentarily alter the value of a consequence. And this can happen before or during the antecedent. So essentially those, I like to think of this more as sort of biological needs. Things like missing breakfast and being hungry, or sort of having lack of sleep and therefore being tired, or skipping a medication and feeling ill. these can all really alter how a child then will behave. And then it will also alter the strength of a reinforcer or the strength of even a prevention strategy, because the child is not their typical self, essentially. So a kiddo who usually reacts very well to a teacher, whenever a teacher requests something, may become more uncharacteristically agitated or aggressive because he's feeling tired or sick or hungry. And so essentially, these setting events can be addressed in a number of ways. One way is to have the child who is sort of, uncooperative, just providing them with, if they need food because they're feeling hungry, sort of providing a healthy snack. An example of this might be if, as a parent, you go and pick up the child at school, and typically once you pick them up, they're sort of irritable, and when you get home, sort of behaviors begin to appear because of this irritability, because of potentially them being hungry. Then you might want to then begin bringing a light snack for the ride home. And that might be something that could really target that setting event of having, feeling hungry and essentially being irritable. Can think of it as being hangry, right? If the child is able to have food in their stomach, they might not then act up in ways that they would if they were feeling hungry. So these are just a couple of examples of ways that you can sort of set the stage for more appropriate behaviors, or set the stage for the removal of some inappropriate behaviors due to some potential setting events that are more biological in nature. So the last category of prevention strategies, and the one that we'll be focusing a little bit more on and go a little bit more into specific examples for, is the use of visual and auditory cues. What this really means is providing children with a little bit of a hint for what you're asking them to do, right? This might come in a number of ways, specifically visually and auditory hints. There are choice boards, timers, first and then boards, daily schedules, and then what we call task analysis. And I will be going into each of these to provide a little bit more examples of these, where in essence they're sort of prompting strategies in a way. So one example of a visual prompt or a visual strategy or cue is choice boards. And here you see three different examples. The very first example on your left is a picture of a choice board for virtual activities. And so essentially you may tell the child, sort of choose an activity from anywhere from these 4 different rows in orange, but you need to choose one from the purple columns and one from the green columns. So essentially they're choosing 2 different activities that they're doing, or 4 different activities out of this, this list of activities. In the middle, you have an example, and you'll see that it varies as far as the amount of words or whether or not it has pictures in it. This will always be dependent on the child's ability, right? So that first one has pictures as well as words, whereas the middle one, the pictures are more prominent and the words are smaller, might be for younger kiddos or kiddos who may not be reading just yet. But essentially that choice board in the middle is providing a choice of drinks. And so showing the child a visual cue of the specific items that are available and then having them sort of choose one is really going to prevent some challenging behaviors that may come up from, say, telling the child, drink this, or you have to do this, as opposed to doing that. What would you like to do, right? What would you like to drink? And then the last one is essentially an example, maybe in a classroom, in a English classroom, reading classroom, a set of literacy activities, and sort of allowing the child a choice between these activities, pick 2, pick 3. And again, more autonomy, more choice, more likely that they will then comply with the demand. The other type of visual and sometimes even auditory cues is the timers. And so right smack in the middle, you'll see what a timer for an iPhone typically looks like. So you can very easily use a timer on your phone to provide the child with specified amount of time or a cue for how long they have before they have to transition to another activity, or how long they have to engage in that activity. So an example of how long they have before they have to transition might be something like, okay, in 5 minutes, I'm gonna need you to put on your shoes because we're leaving the house. So providing them some time before they have to engage in something or before they have to transition. Or you have 5 more minutes to play with your toys. That would be sort of providing a visual and auditory representation of how much time they have to be able to do what they're engaging in. And then on either side of that, you'll see different kinds of timers. On the left-hand side, this specific timer has the color red to show how much time is left, or how much time the child has left to engage in that activity or before the activity is up. And then on the right-hand side, the same idea, you have the sand clock. And so the child has a visual representation of how much time is left by seeing the sand sort of dropping down. So these are great examples of different kinds of timers that could be implemented, but essentially implementing timers in this way could prevent some behaviors in that instead of abruptly stopping a child from engaging in an activity that they've been doing for a while and just saying, okay, we have to go, let's go right now. Sort of providing a little bit of time and prompting them, okay, you have 5 more minutes before we have to go, will essentially provide the child with more predictability in their transition. The next strategy that we have that is more visual in nature is a first then board. And so essentially you would let the child know, again, going back to that grandma's rule, first eat your veggies, then you can have the dessert. You can really let the child know first you need to work, then you can have the computer. So providing an example of those two things the first thing that they have to engage in and what they will be receiving or the activity that they will gain access to once they're done with the first one is something that can essentially also be considered changing the way that you ask, right? Because you're providing a child with, if you do this, then you'll also be able to do this after. But in terms of a first then board, it can easily be implemented by sometimes even just drawing it on a piece of paper or writing the words, first work, arrow, then computer, and then providing that visual to the child. I don't have very specific examples, and I honestly wasn't planning on mentioning these, but there are quite a few apps actually that you can easily download that are essentially first then boards. There are also apps for timers. And so some of these things can really easily help sort of when you're on the go and you need to implement some of these activities. So first then boards are great. The other type of visual cue that can be provided is a task analysis. And a task analysis, what it really means is when we learn, essentially when we learn a new task, we don't learn to do the entire thing at once. We learn to do it in pieces. And so in thinking about when you're brushing your teeth, you might have learned first to uncap the toothpaste, grab your toothbrush, put on some toothpaste on the toothbrush, and so on and so forth. And by the time that you're done learning every single one of those steps, you can now brush your teeth. And so when you analyze a task or task analyze a specific activity or demand, it allows the child the opportunity to learn all of the steps and therefore engage more properly in the demand. Essentially, what this gets at is the high chance that the child may not be complying with the demand because maybe they just don't have the ability set or the skill to do it. And so first teaching them all of the steps that go along with it is really going to go a long way. So I'm going to show you a video from a series that the U-TTEC lab with Dr. Aaron Fisher has created, specifically the BURST team. And BURST stands for Behavior Response Support Team. They've created a series of videos that have a number of strategies that are evidence-based. And so this one specifically talks about task analysis. Let's watch.
Hi there, are you having a hard time getting your child to complete basic house chores independently? Help your child be more independent by providing a detailed description of how to complete the tasks. First, write out all the steps to complete the specific chore. If possible, illustrate it too. Second, review the steps and teach your child to use the checklist or picture schedule. Third, give your child praise as they complete more and more steps independently while using the checklist. Fourth, once your child is successful, fade away the use of the checklist. Remember to tailor the steps and details to your child's age and ability. Thanks for watching.
Okay, so another great way to implement a strategy that is visual in nature is a task analysis. The other kind of visual support or visual cues that can be implemented to sort of set the stage for specific behaviors to happen or to avoid more inappropriate behaviors is daily schedules. And so essentially, this is just sort of establishing a very specific routine. They can be implemented during very specific times of the day when the behaviors, the challenging behavior is more prominent, or they can be implemented throughout the day to show the child sort of a visual representation of what their day will look like. Oftentimes, it also provides you an opportunity to maybe change the time of a demand. If a child is engaging in challenging behavior during a specific time of the day, then perhaps changing that demand to another time of the day could be beneficial. An example that comes to mind is potentially bathing. If a child is giving the parents a hard time bathing in the mornings, and it's more challenging because at that point, there's sort of more at stake as far as like making it to work on time, making it to school on time, then potentially changing bath time to the evening before the kiddos go to bed might essentially be a way of preventing some challenging behavior in the mornings when the time is sort of more, it's sort of shorter in time to be able to move on to other transitioning to work or school. And then the other thing to keep in mind is, again, going back to changing the order of events, potentially having fun activities be used as rewards for completion of less desired activities. So in the morning, if the child is not wanting to take baths, let's use that example again, maybe allowing a little bit of time after they've taken the bath and before they have to head out the door or have breakfast, to maybe watch 5 minutes, a 5-minute video, or play for 5 minutes with their favorite toy. And so essentially using fun activities to reward that less preferred or less desired activity is really going to help. Another consideration is perhaps if the child doesn't want to stop watching the video or want to stop playing, then that might not be a great activity to implement. But these are, again, things that you can think about depending on your child's ability, depending on the specific demands in your family and things of that nature. But setting daily schedules is really going to be important. And oftentimes, having a routine is really important, but displaying that routine by using visual schedules can really be beneficial. And so what this means is creating a schedule of the day using pictures, and oftentimes using your child, taking pictures of your child and showing your child that he or she is engaging in the specific activity, and what that potentially looks like, is really beneficial. And so to be able to develop visual schedules, one thing is to involve your child in developing that routine. So asking your child, do you prefer doing this first or this next? Maybe taking pictures of them, so now they see themselves in this visual schedule, or maybe having them help you decorate the schedule. All of these things, as far as involving the child, again, are going to provide the child a sense of, I helped with that. And so there's a little bit of motivation that goes along with them feeling involved in the process. Also deciding what format to use. Again, do you want to use pictures versus words? Do you want a checklist where the child is able to check off, and so potentially just in a page or paper? Or do you want a poster and have it posted somewhere? And then do you want it paper version, or do you want it digitally? Because again, there are apps for that. And so having schedules in apps or in an iPad, the child can see also, it's another thing to think about in terms of the format. Also decide on the time frame. I mentioned earlier, you might want to have very specific routines or visual schedules for very specific times of the day when the challenging behaviors are more prominent. Or if you want to think about doing it for the whole day, and that will really depend on your child and your ability to also be very consistent in implementing this. Consistency is key in terms of implementing all of these strategies. And so if implementing a visual schedule the whole day is too demanding for you or your family and your specific family dynamic, then maybe implementing it in the morning or in the evenings to begin with could really be beneficial. And then finally, deciding on a location. Do you want to place this daily schedule up on the fridge where the child is able to see it and come to it every single time? Or do you want to place it in their bedroom so that it's sort of theirs and they can see it every morning and every night and throughout the day? That's something else to think about. And then in terms of implementing the actual visual schedule, here are the steps. You want to place the schedule in a central location, again, whether that is the fridge in the kitchen or a wall in the bedroom. That will really depend on the child and your family. You also want to encourage the child to check the schedule during that time frame when the schedule is supposed to be implemented, and potentially review the schedule with the child, and then select that first activity. So one way that you can implement a visual schedule is by making it very interactive. You might use Velcro, you could use tape, but essentially maybe having the pictures be easily removed so that the child is now holding on to the one activity that they have to do could be really helpful. And so with that step 3, having the child review the schedule with reviewing the schedule with the child, and then having the child select the activity, and then encouraging the child to sort of say out loud what the activity is. So if it's a morning time activity and it says brush teeth, then essentially having the child say brush teeth, and then having the child take off the picture and then walk to the designated area. So again, if it is brushing the teeth in the morning, then having the child remove the picture and walk to the bathroom and complete the activity on the picture in the designated area. There are a couple of other ways to do this. You can have the child return to the visual schedule and sort of place the activity that they've just finished into an envelope or some sort of area that kind of lets them know I am done. Could be a basket. The idea is that they can sort of have the sense of I finished this, I can put it away somewhere. And then they can move on to the next activity on the visual schedule. Again, implementing visual schedules is really going to impact whether or not certain challenging behaviors may come up, And these are really beneficial in terms of providing kiddos with predictability in their routine and some control over the kinds of activities that they will be engaging in throughout the day. So these were all of the activities that I wanted to make sure that we went over today. I've also included here a list of references. The majority of these activities have been taken from the Parent Training for Disruptive Behavior manual, as well as some examples from a book on applied behavior analysis. And then there's also been some additional information from some studies and articles. And so if you have any questions beyond the Q&A session that Ashley will be going over in just a moment, you're welcome to reach out to us. These are our email addresses. And again, thank you for being a part of this webinar. And we look forward to the questions that you might have moving forward.
Awesome. Thank you everybody for being here again. Annie did a great job. Again, if you have any questions or would like to see her slides, feel free to send out an email. We can send out her contact information as well. But we just want to open up these last few minutes, about 8 minutes left for questions. Anything you would like to go over. I'd also like to touch on really briefly. I love that she brought up a lot of these visual aids that can be used. And I just wanted to point out that so many of these things have already been created for us. That we can be as creative as we want, but there are things like Pinterest and Teachers Pay Teachers that are just available for us to access already. So like so many of my professors love to say is don't recreate the wheel or reinvent the wheel. And we don't have to do that. You can if you'd like and be as creative as you'd like, but there are so many resources and apps and things, printouts available for you as you're looking to address some of these or implement some of these prevention strategies. So yeah, Annie did a great job. Thank you, everybody. I'll make sure to pass all of this praise along to her. But if there's any questions that anyone has, she also wanted me to point out an app for for picture schedules. It's called This for That. So feel free to look into that if you'd like. Again, just an app available to you to help implement some of these strategies.
Yeah, I have a question. That was a lot of really awesome information. I guess for parents maybe who are feeling overwhelmed and they feel like that's too much to do all at once, what would be like the easiest yet most effective out of those techniques that you could implement?
I think the nice thing about a lot of these strategies is that they're all pretty equally effective and you just kind of pick which ones work best for your family. So if you're looking at like a visual schedule and you're saying that is way, way too much for me to even try to get started, some of those other things can work just as well. And it's kind of picking things that already work best for you as a parent that is most feasible to implement and that works with your child and what has been shown to be effective for them. So I think that would be a great place to start, is just what seems most feasible for you, because I think all of these could be implemented in a way that's effective. Thank you for your question, Morgan. I think that was great.
Thank you.
Another thing I really love about just the concept of identifying some of these prevention strategies is that collecting data on antecedents and some of these things that Annie talked about doesn't require any sort of formal training. It's something that parents can do pretty easily, and identifying some of these prevention strategies are things that don't require a lot of schooling or any of these things that feel so out of reach, is something that people can do pretty easily. And so it's something that parents or teachers can implement in their homes or their classrooms in a way that is helpful for them and doesn't require a whole lot of work more than is necessary.
Ashley, great job summarizing this stuff and some great suggestions that you're bringing, as well as the presentation that Annie did. I'm wondering, when thinking about these antecedent strategies, there's there can always be some like pushback. Oh, why would I do that work on the front end? Or it seems like a lot of work to do. I want to do something more on the consequence side. Can you like help us for like parents or caregivers or educators who might watch this, like how to understand that it is worth it maybe to put the work in on the front end?
That's a great question. I think if I were to explain why I think it's important in my own like personal experiences with these things, is it saves you a whole lot of work on the back end. Some of these strategies that are related to consequences or direct behavior interventions take a lot of work. And some of these prevention strategies are pretty simple fixes. And so you can implement these things and just kind of save yourself some trouble in the long run, I think is beneficial. And also just, you know, these things are just as effective in decreasing problem behavior or increasing behaviors that we'd like to see. And so, you know, if it's a little bit easier, yeah, absolutely makes sense to try it out. Any other questions? These have been great. Thank you all so much. Perfect. Well, I think we can go ahead and wrap up. Annie, I don't know if there's anything you want to finish us up with, but thank you all so much again for attending and for your support.
Thank you, Ashley. Again, great job to both Annie and Ashley for today's webinar. So that will conclude today's webinar. This webinar will be recorded, is recorded and will be published on the U-TTEC Lab website, which could be accessed by typing in U-TTEC.lab.com. And we'll also provide the presentation slides on the website as well. We'll have our next webinar in a couple weeks, so please stay tuned for that. And again, thank you everybody so much for joining.